Hi, my name is Rob Mills, and I'm a Doctor of Physical Therapy student at the University of Kentucky. Today, I'm here to talk to you about wellness and lifelong exercise, the key to dealing with chronic pain. To start, we'll just do a quick overview of what chronic pain is. So, in the US, 1 in 5 people will have chronic pain. Chronic pain occurs due to overstimulated receptors in the brain that make typically non painful stimuli perceived as painful. Many people turn to opioids to treat this type of pain, but that is the worst possible option for treating this type of pain. This leads to activity avoidance and musculoskeletal deconditioning that, as you see in the graph on the slide, that if you have an injury, you have a painful experience, and then a negative response to that is avoiding movement, which leads to depression and disuse, which increases the pain, which leads to more avoidance, which continues down that negative cycle. Instead, we would like to see an injury with a painful experience, conquering that fear, confronting that fear, and then recovery. Treatment to chronic pain takes a multifaceted approach. Exercise is one of the main components in managing chronic pain, and one study said that walking can be recommended as an effective form of exercise or activity for individuals with chronic musculoskeletal pain, but should be supplemented with strategies aimed at maintaining participation. Exercise is great and incredible at helping reduce pain levels, but it must be maintained to be effective. Why does exercise help? Exercise releases endogenous opioids, which are opioids that are made by our own bodies to help combat pain. This is much safer than taking opioids that are prescribed because opioids that are prescribed have a large chance for addiction as well as other negative side effects. One study stated that regular tomatic aerobic exercise reversed the sensory hypersensitivity observed in spinal nerve litigation model of neuropathic pain. So this study stated that exercise actually helped reverse those overstimulated receptors in the brain. Exercise has many other benefits as well. Exercise is relatively low risk. Walking is considered safe for formerly sedentary individuals. This means that people who have not exercised for long periods of time are safe to begin a walking program. It improves respiratory function as well as blood pressure and all the other positive effects that you've heard about exercise all of your life, such as improved sleep, improved cognition, better mood. For more information on all of the benefits of exercise, please look at Hannah Little's presentation on this toolkit. The American College of Sports Medicine has recommendations for the amount of exercise people should get in a week. If able, they recommend 150 to 300 minutes of moderate aerobic activity or 75 to 150 minutes of vigorous aerobic activity. Also, they recommend 2 days a week of moderate strength training. Now, these are guidelines that we would like you to reach eventually, but we are not expecting you to reach them from the time that you start. Some exercise is always better than no exercise, and doing what you can working up to these ranges is just as beneficial. So if you need to take exercise in bouts of 10 minutes, that is perfectly acceptable. Just do whatever you can do for as long as you can do it and work yourself up slowly to being able to reach these guidelines. Find something that speaks to you. There are many different forms of exercise, and the most important thing is that it's something you enjoy to do. The most effective type of exercise is the exercise that you will do and do consistently. Some examples are listed here for you, such as walking, Pilates, yoga, and Tai Chi. But finding something that you are passionate about and that you enjoy doing will be the most beneficial to you. Who should you see for help? Talk to your PT. Physical therapists are the musculoskeletal expert and have training in treating chronic pain conditions. They will do a full evaluation and be able to give you a better idea of what specific muscles you should focus on, as well as other things that you may need to focus on, such as improving cardiorespiratory endurance, muscular strength. All of these things a PT can diagnose for you and give you a plan to help you improve those functions. They're also a great resource for the community that will be able to connect you to other wellness programs that interest you. Here's some things to remember. Exercise is a lifelong process. This isn't something you're just going to do for a couple of weeks and expect to never have pain again. This needs to be a true lifestyle change where you can continually do this as part of your everyday life. Consistent exercise is key. We want you to do a little bit of exercise every single day. We do not want you to do so much exercise one day that you are not able to do anything for the next several days. This is not as effective as doing a little bit every day. Exercise is a key component, but it's not the only component. Remember to seek out all the other services that will help you combat your pain and addiction. Continue to see your PCP, continue to see your physical therapist if needed. Continue to go to AA or NA meetings if you go to them, and if you don't go and need those services, seek those out. They are very beneficial and will help you along your journey to recovery. Healing takes time. Remember, this isn't something that just goes away after a couple of weeks. And it's okay to have setbacks. Setbacks happen and they are a normal part of the process. Just recognize what caused the setbacks, learn from them, and then try not to repeat those setbacks in the future. And ask for help when you need it. It is totally normal and completely acceptable to ask for help. Everybody reaches points where they don't know what the next step is. And at that point, seek out either your PCP, your physical therapist, or whatever help you may need in order to make the next step in your journey to recovery. Here are some resources for you to help you find services in your local area. Find a PT is a website to help you locate a PT in your area. Just enter your zip code or your address, and the service will give you a list of PTs in your area. YMCA 360 is a free online fitness class server that the YMCA has provided. The classes last from 10 minutes up to 45 minutes and cover all sorts of different topics based on your interests. There is something there for everybody. TrailLink helps you locate walking trails in your area. This is great if you love to be outdoors. This will help you find safe walking trails in your area. And don't forget about the local public high schools. Many of them leave their tracks open for the public to use, and this is a great option for people, specifically people who may live in an area where sidewalks are not readily available. Also, don't forget about your PT clinics. Many of them offer wellness programs where you can come in and work out just like any normal gym, but the PT is there if you have any specific questions, and they'll be able to help guide you along in your journey. Here are the references for my presentation today. Thank you and have a good day.